We do have a very high incidence of cancer in our area, and the statistics tell us that 25% of people across the nation would have polyps, colon polyps. And that's what we're looking for is colon polyps begin as a small little growth in the colon, and that's what we call a polyp, also known as adenomatous lesion. Those polyps, if given about 8 to 10 years, then turn into colon cancer. Again, 25% of the nation has that. Our area, when we went back and looked at the sample size that we had of the hundreds of patients that we've done scopes on, 44% of those had polyps. So that's a much higher statistic than you would normally find. That's due to a lot of different reasons like genetics, diet, and overall carcinogens that we would be exposed to. And so that does mean that we have a lower threshold to get colonoscopies than, say, someone or a physician in California would. So there are multiple screening methods that you can do: Cologuard, fecal occult blood, but the colonoscopy is the actual gold standard for screening, in which you actually do the colonoscopy prep and you look inside the colon and see if there are any polyps. The good thing about a colonoscopy versus the others is that we can actually take out any polyps while we're in there. But we can also treat other diseases like diverticulitis, diverticulosis, colitis, things along those lines. Preparation for the screening colonoscopy is generally the worst part about the colonoscopy. When you come in the day of the colonoscopy is the easy part. Nothing to eat or drink after midnight. And then you have an IV put in, which is generally the worst part of that day. And then that's it. You have the procedure done and you go home and you rest it off. But the day before is when you do the actual prep. Our prep that we do is a Miralax prep. We basically have, you get about 64 ounces of Gatorade or whatever juice or tea or soda that you would like to drink with. Water works fine. And you mix it in there. I myself have actually done the colonoscopy and had the prep, and I found it to be a lot better than the other preps that are out there. So those that perform the colonoscopy in the region are general surgeons and GI physicians. When you come in that day, you will be taken back to the endoscopy room, which is in the operating room, and we do give you some medication, so you don't go all the way to sleep. There's no breathing tube or any apparatus to help you breathe. So you do breathe on your own, and you're able to somewhat respond to commands, but you don't remember anything. And my experience was, I remember my CRNA said, "Okay." Then the next thing I know, I remember the nurses in the PACU telling me it was time to wake up. So I felt pretty good, and it was a good experience, and that's what we strive for. How we handle that is that the patient can call and say that they're 50 years old and they never had a colonoscopy, and we look over their insurance. Some insurances do require a referral to even be seen, and if that's the case, then most of the time we'll handle that for you, or we'll call that physician's office, and most of the time they're very happy to assist us with that. But many insurances do not require a referral, so we make it as easy as possible, where we just send you the paperwork and grab you an appointment. So the main takeaway message would be that if you're over 50 years old or you have a family history of colon cancer, certainly getting screening is not as bad as you would think, and it's a very easy procedure to have done. You come in, have it done, and the best part is we can prevent potentially deadly colon cancer from happening, because colon cancer does not show up and there's no symptoms associated with it. And so oftentimes people will show up with a bad colon cancer that they've had for many years, that if we've done colonoscopies we could prevent. So it is a very preventable illness, and with appropriate screening we can prevent most all that are not genetically created.